Gene therapy is a game changer for our son.
If this treatment didn't happen, then he wouldn't be around for very long. So that's the first thing. And then anything we have from there is just a bonus. It's been a massive ups and downs, but being able to now have the treatment is just going to be a game changer for us. So yeah, we're just over the moon and very grateful to everyone. Our hopes are, as I say, just that he can have the best possible life. In terms of his movement and stuff, we don't know, but we're just going to try as best as we can, give him everything he could possibly need. He's a lovely, happy little boy, and throughout all of this, he's always kept us happy by the way he smiles and the way he interacts with us, and he's laughing. So it just keeps you going, you know.
Baby Arthur is just 5 months old. He has no way of knowing the treatment he is receiving in his right arm is the world's most costly medicine. His devastating progressive disorder causes loss of muscle control. But he has become one of the first patients to be treated on the NHS with Zolgensma, a gene therapy with a list price of £1.795 million. Around 40 children are born with the most severe form of spinal muscular atrophy, SMA, every year. Untreated, they rarely live beyond 2. The NHS has negotiated a confidential discount, which means dozens of infants can be treated each year with Zolgensma, which is manufactured by Novartis Gene Therapies. Arthur, from southeast London, finds it difficult to move his arms and legs and cannot lift his head, so some permanent damage has already been done. The hope is the one-off treatment will stabilise his condition and prevent further deterioration. His father, Reece Morgan, says there have been many ups and downs. Our hope is that he can have the best possible life in terms of his movement, he says. We don't know, but we're just going to try as best as we can to give him everything he possibly needs. So how does Zolgensma work? The drug contains a healthy copy of a missing or faulty gene called SMN1. This is inserted into a harmless virus. In the body, the virus delivers the replacement gene into the nucleus of motor neuron cells. This is essential to prevent the cells from gradually dying. The now healthy motor neuron cells start producing the missing SMN protein, which is vital for muscle function. Evelina Children's Hospital in London, where Arthur is being treated, is one of a handful of centres which will be offering Zolgensma. For specialist NHS centres have now been commissioned across the country. The other sites are Manchester University NHS Foundation Trust, Sheffield Children's NHS Foundation Trust and University Hospitals Bristol and Western NHS Foundation Trust. Dr. Elizabeth Rage, a consultant paediatric neurologist at the Evelina, explains that this treatment can really alter the outlook for these children. 20 years ago, a baby born with SMA would have a very shortened life expectancy, she tells the BBC. Now, we have the potential to enable children to acquire motor skills such as rolling and sitting and even standing walking, that would have been impossible without treatment for SMA. NHS England Chief Executive Sir Simon Stevens says it is fantastic news that this revolutionary treatment is now available for babies and children like Arthur on the NHS. He adds that Zolgensma is among the life-changing therapies being routinely used by the health service. Sally Ann Zangarides, General Manager at Novartis Gene Therapies in the UK, calls it a hugely important step for babies in England. We thank all those who have been involved in the landmark agreement that has made it possible, she says. Despite the high list price, both NICE and the Scottish Medicines Consortium recommended the NHS fund the treatment. Trials have shown it produces lasting benefits, which endure at least 5 years, and perhaps will prove to be permanent. The only other treatment for SMA involves costly spinal infusions which need to be given at least 3 times a year.
Thanks for watching Universal Information and Entertainment TV. Please like and subscribe our channel for more updated videos, news, information and entertainment. See you in next video. Stay tuned.